So welcome. Thank you for being with us. My name is Meredith Kwok. I am the Associate Director of Alumni Relations, and you are here joining us for the second UCI Faculty Fireside Chats. As you may already know, the UCI Department of Clinical Pharmacy Practice was officially approved on July 30th by the UCI Regents to form the new School of Pharmacy and Pharmaceutical Sciences. This new department is led by founding chair Alex Chan, who was hired in January, now has 9 faculty members, and will be accepting student applications for the fall of 2021. Whether you're joining us live or viewing this as a YouTube recording and you're a fellow faculty or staff member, alumni, student, friend, or prospective student, I hope you will join us in recognizing and celebrating this very exciting time of growth for our program and the UCI Susan and Henry Samueli College of Health Sciences. So just a little Zoom housekeeping. I encourage you to chat and connect with us in the chat feature. And then if our audience that's here live has any questions, please use the Q&A that's in your toolbar on the bottom. And this will allow you to engage in this live organic conversation if you have any questions you'd like to ask of our faculty member here today. This will be recorded and shared on YouTube for viewing purposes in the future. So welcome, Dr. Christine Cadiz. Thank you for being with us. Welcome to the team and back to the Anteater family.
Thank you, Meredith.
So I would start with reading a bit from your bio, but you have such a unique and special sort of journey through the UC system that I would rather you take us on. So can you share your educational history with us?
Sure, Meredith is right. I'm actually an anteater, so I am an alum of UCI, but I'm also an alum of multiple UCs throughout the University of California system. I started with my undergraduate training where I received a degree in aquatic biology, so a bachelor's of science, and then a bachelor of arts in cultural anthropology at UC Santa Barbara. So I was a gaucho and loved it. After that, I attended UC Irvine's School of Education to get my Master of Arts in Teaching. Following that, I was a middle school science teacher for several years. And fun fact, during my time at UCI School of Education, that's where I met my husband, who also went through the program and is still a high school marine biology and biology teacher. I really, truly loved teaching, and I enjoyed working with the middle school students as well. But something really compelled me to go back to school, obtain my PharmD, and give back to the community through education in a different way. Mm-hmm. I'll tell you that my father is a pharmacist, and he really did inspire me to go back to school. I watched him when I was a senior in high school. I watched him study for a year because he was a pharmacist back in Vietnam. It was decades earlier. As I mentioned, I watched him study for a year on his own from Coda Kimball Therapeutics book and studying the books for a test of English as a foreign language, as well as the test of spoken English. And he passed all his licensure examinations on the first try. And I just remember thinking back and that really inspired me to go back and look into pharmacy as a career option. So from there, I went to the University of California, San Diego Skaggs School of Pharmacy and Pharmaceutical Sciences, where I obtained my PharmD. And following that, at my last, well, actually, not my last UC because I'm back at UCI, but I completed my PGY1 pharmacy practice residency at UC San Francisco Medical Center. So that's my journey through the UC system.
So we've got UCSB, UCI, UCSD, and UCSF. Right. Back to UCI.
Correct.
I'm glad you haven't left the family. So my next question was going to be, so middle school science teacher, into pharmacy.
Mhm.
So, but you said that, your role model is your dad and family was very important. So, do you hope that your sons will follow in your footsteps?
I want them to find their own path. I'd be so happy if they followed in my footsteps, but I would support them if they found another path too. However, my 7-year-old son, who just turned 7 last month, has been telling us lately that he wants to be a teacher when he grows up.
That's wonderful. We need more teachers. That's great. So he's definitely taking a page out of your book.
Yes.
So your clinical practice focus and your teaching subjects have been quite diverse. I have a little sneak
Mhm.
peek to your bio. Do you mind sharing that with us?
Sure. In terms of clinical practice, for the last 6 years after finishing my residency, I've been practicing primarily in general medicine in the inpatient setting, as well as in transitions of care in the inpatient and ambulatory care and clinic setting. Um, at my clinical practice site, I was also heavily involved in training students and precepting students in both those subject areas, as well as in training residents as a primary preceptor and also as a residency program coordinator and residency program director. My teaching in the last 5 years was focused primarily in therapeutics in the areas of nephrology and heart failure, but I also taught students in clinical application of pharmacogenomics and in point of care testing in the community setting.
Wow. I'm impressed. Any interesting projects that you're working on right now on the teaching or the clinical side?
Yes, actually, I'm really excited to be here at UCI. Heard a little bit about my journey through the UC system. As a student and as a resident, I trained primarily in big academic medical centers and teaching hospitals. So, having been in a community hospital setting for the past 6+ years, I'm really excited about working at UCI Health among not only our pharmacy practitioners, but professionals and trainees from other disciplines. So I'm very used to working with residents and fellows and looking forward to that again. There are a lot of really great opportunities to help expand clinical pharmacy services within UCI Health. And one thing that I have been working on is helping or uh, meeting with the cardiology team to develop a pharmacy practice in collaboration with that team to take care of patients with advanced heart failure that require ventricular assistive devices or VADs. So I'm really excited about doing that. And I envision hopefully a service in the future that's very robust that integrates pharmacists in the inpatient and outpatient setting to take care of these patients that have quite complex medication needs and monitoring needs, as well as educational needs.
This is definitely an exciting time to be a part of UCI. Not only is our College of Health Sciences growing, but our medical center is expanding
Mhm.
rapidly. So thank you for being with us. You answered this a little bit, but anything you can expand upon why UCI right now in your journey?
Yeah, I mentioned a little bit about wanting to go back to an academic medical center, but the other thing is that I feel like the Southern California community, and especially the UCI community, has been excited about the School of Pharmacy and Pharmaceutical Sciences opening for quite some time now. And for me, it's a really exciting endeavor to join UCI as a founding faculty member at the school and in the Department of Clinical Pharmacy Practice. Not only do I get to work with a phenomenal team, we have really strong leadership, and I think we're going to build what's going to become one of the top pharmacy schools with a really strong emphasis on research, interprofessional collaboration, and training PharmDs for the future.
Absolutely. And it must be exciting to be a part of this first class. Any
Oh,
message for
totally.
the future students that will be joining us next fall, 2021?
Gosh, I'll think of something to say as in terms of a message, but what I can say is so far, I've just been really excited about working with the staff and faculty at UCI. The teamwork and collaboration has been amazing, even in the situation we're in where we're not all physically together, we're still working together. My colleagues really have already inspired me, but I can't wait though for our inaugural class to start so I can meet them next fall. I feel like that's where I thrive the most. I just love being around the energy of students, and I truly feel overjoyed when they succeed, and I feel like I can share in their successes. So what I'm really looking forward to is mentoring our students, getting them involved in professional organizations and community outreach. And I can't wait until the day we can see the tremendous impact that our students make as innovators and leaders in our profession.
There's absolutely a buzz around this new school. I couldn't agree more.
Mhm.
So many of the alums that I speak to say, "Oh, I wish when I graduated with my undergrad degree that this PharmD program was here. I would have stayed forever."
I've heard that multiple times.
There is a real community family feel to UCI and to the pharmaceutical sciences program that I'm sure
Mhm.
is carrying over into this new school. So I know we're biased, but I have to say it because
Right.
I
Same
feel
here.
it as a staff member. Yeah. We were just talking before this started. The new offices are open, which again will change with the expansion
Mhm.
of the College of Health Sciences. But do you mind sharing for those that don't know or haven't been on campus? I know you're recently back, but where those are and what's happening with that?
We're in the Bison Modular Building, and it's great because I finally last week got to meet a couple of my colleagues and my department chair, Alex Chan, in person for the first time. It was, we had to adhere to limited capacity in the building, but it was really great to see them. Our offices are set up very nicely, and I'm just excited about having that workspace and kind of a hive to meet up with my colleagues and share our ideas.
We'll get back there soon.
Yes.
So we'll table UCI for a second. So pharmacy on a whole, what is the most exciting in the field of pharmacy in your opinion right now?
I've always thought that the field of pharmacy is really exciting because even though most of the public doesn't know this, it's a very diverse career with opportunities in direct patient care, research, and innovation. I've always loved that pharmacists work in so many settings from community pharmacy to hospitals to skilled nursing facilities or nursing homes, managed care organizations, industry, colleges and schools of pharmacy like us, and in the federal government, and even in professional organizations. One student that I taught in the past has a really key leadership role advocating for pharmacists in our profession. So I think that's really exciting. I alluded to it earlier in terms of my teaching interests, but one of my research interests, and one thing that I think is an exciting development in the pharmacy profession, is the growth of pharmacogenomics, which, as genetic variations can affect the body's response to a drug. And pharmacists, in collaboration with other healthcare providers, can use that information to select the right medicine for patients to help them produce better outcomes and reduce the occurrence of side effects. The other thing I'm really passionate about that I didn't mention earlier in terms of my journey is in increasing our pipeline for pharmacy and for STEM in general, and increasing the diversity within that pipeline. I mentioned that I taught middle school, and I still have a really deep connection to those young kids and even younger kids in elementary school. So, one of the things that I started working on when I was a pharmacy student at UCSD that I continued on in my role as a faculty member at my previous institution at Keck Graduate Institute was an outreach program to engage students in opportunities for careers in pharmacy and in healthcare. So, the most recent one was at KGI. That was called Farm Camp, where we exposed young kids from fourth and fifth grade on through middle school and high school to opportunities in pharmacy and healthcare through a really fun, interactive on campus program. And we had turned that into a more longitudinal program too to get kids connected more often. So, I know I would be remiss not to mention something that's been highlighted more in recent times, and rightfully so, is equity and diversity. I think there are a lot of opportunities for us in our profession, not only through outreach, but through our practice to explore non-traditional roles and reimbursement models that help drive a shift towards value-based care. And in particular, related to healthcare is an increased awareness in health disparities and social determinants of health. I think that pharmacists have always been well positioned in various settings, including the community setting, or maybe even especially the community setting, to play an important role in value based care to provide patients with services that help them address social determinants of health. So now, though, that it's being highlighted more, I think it's the time to propel our profession forward to make services like disease state screening and monitoring, comprehensive medication management, and education a lot more ubiquitous than it is now. So I think that's something really exciting that we can help address.
You make such a good point about educating young students on all that's available to them. I hear so many alums that have said they came into UCI really having no idea or thinking
Mhm.
that their options were just, you know, one of three or four or five choices, and then taking a few classes and exploring something they never thought that was available to them. And I also know our students are so passionate about all the diverse opportunities within pharmacy and pharmaceutical sciences. So, congratulations and kudos to you for being a part of educating young students to know that this is available for them.
Thank you. I mean, it's so rewarding to see their eyes light up and them say things like, I didn't even know that this existed. Or, I mean, I'm just thinking back to a fifth grader. I always remember his voice. He was with us on a full Saturday, giving up his Saturday, to do a school field trip. And he just looked at me and said, "This was the best Saturday I've ever had."
Wow. That's amazing. That's great. And I think, you know, to find a silver lining in an unfortunate situation, this pandemic that we're in is, you know, pharmacy and pharmaceuticals and public health are becoming dinner table conversations. So
Mhm.
hopefully that will open some young eyes and ears to career paths in
I
those
hope so
fields.
too.
And I love the farm camp. I know we've laughed about this before. I went to a different spelling of farm camp as a kid that involved goats and cows and
Right.
horses. But I love this take on farm camp. So, of course, nothing's perfect, and we're in challenging times now. What in the field would you change? Maybe you've answered that already, just making it more diverse, the field of pharmacy, but anything else?
Yeah, I feel like it's always been so much of a challenge. I feel like pharmacists have always been pushing for expanded roles and for reimbursement of their services. And what I would change is not having to always demonstrate or fight for or what are the value we bring. And I feel like not only having to fight other, you know, outside people outside the profession to justify the value we bring, but it's also in that kind of self-perception of our roles. So I want to see pharmacists across all settings really recognize the contribution of the value that we have and to shift towards, doing more and more and more and documenting those things so that we can get to a point where we get reimbursed for all those services without having to always advocate for them. I think this goes for my, colleagues in the community practice settings as well as clinics and hospitals, et cetera.
Thank you. So I'd love to get to know you. We understand your professional side and where your passions lie, but as a person, what can we find you doing, Dr. Cadiz, on a Saturday
I'm
aside from farm camp?
I'm a really active and adventurous person, so I've always loved exploring new places and trying new things. One of my great loves, though, in terms of hobbies is surfing. So I'm a surfer. I try to get out there as often as I can, sometimes, at dawn or before the sun comes up so that I
Wow.
can get a session in before work, if possible. Um, I was supposed to go to Nicaragua actually in August on my first surf trip since having kids, which I was really excited about, but that'll have to happen sometime in the future. I love getting the boys out and active too. I have a 7-year-old and a 4-year-old. My husband and I take them hiking, going to the beach, learning how to boogie board, and have taken them traveling too. They to some really cool places like Spain last year to visit family. Um, Beyond that, though, I'm not always moving, so I will I will also just enjoy, uh, a cup of tea or a glass of wine, sitting down and watching a movie and relaxing with the family at home, or hanging out with our huge extended family. I only have one brother, but I have probably upwards of 100 cousins. So there are a lot of
Wow.
family members with
And
their own kids.
are they local?
A lot of them are local in Orange County and then some in Northern California, but also all around the world, which is great because we have places to visit.
Wow, that's incredible. I know travel and exploring other places and cultures is something we all miss, but I think these last few months have taught us just to enjoy the simple pleasures in life as
I
well.
absolutely agree.
So thank you so much for being with us. Last chance for any questions for Dr. Cadiz, but like we keep saying, I feel like a broken record. This is such an exciting time, really, for our students, for our staff, our new faculty, the campus on a whole. So we're so thrilled that you are part of this new family, back into the Anteater family.
Zot,
I'm
wait,
Zot
wait,
Zot.
zot.
Let's see. Try to do it again. We'll make sure you got it right. You got to pull your thumb back a little bit. So
Oh,
you've
there we
got
go.
like a
Oh, like
wolf
that.
going here, like that.
There.
So that's the difference from a wolf and an anteater.
Okay.
I know it's been a while since you were an anteater, so we'll brush up on your
We'll
zottings.
work on that.
So thank you. I know that you are off to pick up some kiddos at school right
Yes.
now, so we won't keep you. But thank you for being a part of this new series, the Faculty Fireside Chats. As we said, this will be recorded for future viewing purposes for any prospective students or alumni that are really excited about our new program.
Thanks, Meredith. It was really great to join you.
Great having you. Thank you, Dr. Cadiz. Oh, we just have a fun message from your fan club. Can't wait to be on campus and talk pharmacy and fun stuff someday. Dr.
Looking
Hurley.
forward to it.
Thank you. We'll be there together.